Okay, bag level mask. This is going to be at your guys' level, like the prime of your airway management. We have an unconscious patient. They're not breathing, or they're not breathing adequately. That could just be it. It could just be an unconscious patient who's breathing at 38 breaths per minute. Then that's somebody that we need to bag, and we need to slow them down to that 12 to 20 breaths per minute. So we can bag both ends of the spectrum, from not breathing or breathing 2 to 3 times a minute to that person who's unconscious and hyperventilating. We can do both spectrums, and don't be afraid to do both spectrums either. When it comes to these patients, make sure we got a good mask seal. Make sure we have that CE grip, or ideally have one person who's primarily all focused on just getting that grip and maintaining that seal, and one person who just squeezes that bag. Don't ever be afraid to attach oxygen to these bags. They all have that port. Attach 10 to 15 liters 10 to 15 liters of oxygen to that bag at some point, maintaining SpO2 and oxygenation and perfusion while we bag them, one breath every 3 to 5 seconds for pediatrics, and one breath every 5 to 6 seconds for adults. You will want to do actual seconds. You do not want to do this too quickly. You will cause gastric distension, and they'll end up vomiting on you, and it's just going to be a bad time overall. So you want to watch your watch and do this on actual one every 5 to 6 seconds for an adult, and the breath should be over a second. And we're squeezing that bag only until we see chest rise and fall. These bags you should never squeeze these bags fully. The plastic should never touch plastic for pretty much anybody. Make sure you're using the right size bag. They make these in adult, pediatric, and infant bags. Don't ever use an adult bag on an infant. I don't care how good you think you are. All it takes is one person to bump you, and you squeeze that bag too much, and you do damage. Watch the amount you're squeezing. Like I said, we're looking for chest rise and fall. Watch your rate. We don't want to cause gastric distension. If you do see gastric distension start to occur, just adjust your rate, adjust your pressure, and that'll start to relieve itself a little bit more. The thing to keep in mind with fluid and oxygen, or fluid and air, is they will always go the place of least resistance. So when they build up in one area, they have to go somewhere, and that's where we'll get gastric distension. That's with our shock problems and our congestive heart failure problems, which we'll talk about later on. We get our pulmonary edemas and our pedal edema with those, because fluid has to go somewhere. Same thing with oxygen and air, right? With this, when it comes to bagging patients, like I said, we want to get them to that one every 5 to 6 seconds for an adult, one every 3 to 5 seconds for a pediatric, 12 to 20 breaths per minute. If they're breathing too fast and they're hyperventilating, we can do it. We just want to match their rate. We want to breathe with them at whatever rate they're doing, and slowly bring it down, and we'll essentially exhaust their drive and take it over for them by doing that. And we'll eventually get them down to one breath every 5 to 6 seconds instead of what they are at. Bagging is, like I said, one of those things that we can do, and we can take over, and we can maintain it for a patient, but you have to pay attention to it. If you're on airway is your life. Do not bag, do not be paying attention to what other people are doing around you, especially if it's like a cardiac arrest situation or it's very hectic. Your job is airway. Your job is making sure we have chest rise and fall on your squeezes, making sure you're going at the proper rate, and maintaining that airway, because we can maintain it, and we can maintain them effectively. You just need to pay attention to what you're doing and do it well, and not get overwhelmed with everything else that's going on. And count with your Mississippis, watch your watch, and you can bag them and maintain that airway and maintain oxygenation and perfusion really well with this. That's all I have for airway management and the pathophys aspect of it. It was pretty brief, to the point. Review the PowerPoints online. Look over the chapters. Once again, ask me if you have any questions. Shoot me a text, email, give me a call. But this was just a brief run through